Welcome to one of the most important videos for a NEET PG aspirant, that is branch selection. Okay, and you should be clear with your branch because selecting a branch is like marriage because you have to stay with the branch for the rest of your life. And I have seen some people leaving radiology residency and taking medicine, means after completing 3 years of MD radiology, he took medicine because he found that his true love is medicine. So this is a guide which would help you to choose your dream branch with a meticulous analysis and perfect roadmap. Before starting, I would again remind you about Justice of Abhaya, the heinous crime that happened to second year PGT of Arjikar Medical College. And you can see that from our college we had done street painting in the college street, and today there was a cultural program in the protest munch, and through our songs and recitation everyone was protesting. So I urge everyone to come and protest both in online and offline, means on the streets you should sensitize people and make people understand why it is very much necessary. Those who are thinking that I am not posting anything, please check my Instagram also and the YouTube community post also. You can get a number of posts, but I believe in doing the protest on the streets. Okay, so you can be divided with my opinion, but don't spread hate. I would ask everyone to come forward and join for this protest. Let's not divide into gender, caste, religion, political parties and all. Let's come forward for one cause, that is justice for Abhaya. Now let's start today's video. That is, to make things easy, I have divided all the subjects into 4 broad categories. Okay, so first is the medicinal block. If your priority according, means you have to at first decide your priority. According to your priority, there could be 4 classifications only. That is, first is the medicinal branches. Those who take medicinal branches, their affinity is towards medicine. Okay, so if your affinity is towards medicine, then you should choose this block. If your priority is work-life balance, then you should choose this block. And if your priority is a surgical stream, you get fantasy and you get the adrenaline rush doing surgery, then your priority should be surgical. And psychiatry I have kept as a separate entity because it's a completely different ball of game. You would know जैसे जैसे वीडियो आगे जाता है, ठीक है. So coming to the first block, that is the medicine. At first, the top is the general medicine. We all know there are n number of DM subjects that you can do. So medicine has a great scope. It is an evergreen branch. After that is pediatrics. If you are willing to deal with the pediatric patients and can handle them, then pediatrics is a good option. These are the topmost 2 branches. After that is the respiratory medicine. The scope here is that you can do DM also in pulmonary medicine and DM cardiology also. As you know that cardiology is a top-notch department, so you can do DM cardiology also doing respiratory medicine. So ये वाला भी ओपन है, तुम लोग कार्डियोलॉजी कर सकते हो. आफ्टर दैट इज इमरजेंसी मेडिसिन. दिस इज ऑल्सो अ राइजिंग ब्रांच, एंड दोज हु वांट द एड्रेनालिन रश, उन लोगों के लिए तो बहुत ही अच्छा है इमरजेंसी मेडिसिन. एंड यू कैन डू DM क्रिटिकल केयर आफ्टर डूइंग इमरजेंसी मेडिसिन. आफ्टर दैट इज जेरियाट्रिक्स you can go for, and geriatrics is a really emerging branch that I have explained in my previous video of highest earning medical specialty, so you can see that video after the video ends. You can also go for family medicine. Limited seats are there, but you can go. Tropical medicine only, I think in school of tropical medicine that is associated with MCK only, their tropical medicine MD is available. And after doing MD in tropical medicine, you can go for DM infectious disease also. So a DM subject is also available if you do MD in tropical medicine. And some have integrated courses like the AIMS Delhi and other institute. integrated DM infectious disease of 6 years. So if you are having a medicine priority, you can go for it. And DM infectious disease, even in AIMS Delhi, you can easily get in 500 to 600 rank also, sometimes in straight round. And another thing that I have kept in medicine, though it is not completely medicine and not completely surgical also, so that is anesthesia. But after anesthesia, you can go for DM critical care, and CCU are mainly managed by the anesthesia people only. So I have kept it in a medicine stream. Now coming to the next block, which is now a trend of the society. People are going for work-life balance and people are wanting work-life balance. Even in NEET SS, the top streams are rheumatology and endocrinology. And in surgery, it is urology. So because these streams provide the perfect work-life balance. So work-life balance is a priority. You can pursue your dreams, your hobbies. And if your priority is this, then these are the streams. First is radiology, top stream, and dermatology. Some people are confused between radiology and dermatology. So which to go for, I am going to explain here only. Actually, radiology as such, MD radiology doesn't have much of clinics. You can get clinics in intervention radiology in DM, and some institute does intervention radiology in MD also. But that clinical exposure is different. Okay, that is inpatient clinical exposure, and that to a limited number of patients. But if you are willing for an OPD basis treatment, like I was willing for OPD visits, so I chose dermatology. If you are willing for OPD clinics, then go for dermatology. And if you are willing for a perfect job work-life balance, actually radiology has the best work-life balance, and income is also very much high after doing MD radiology. If you go in peripheries, you can earn up to 3 to 6 LPM. Maximum is 6 LPM. Okay. So this is a stable job opportunities. Yes, there are questions that AI might take over radiology. It won't completely take over because जो litigations है ना, तुमको तो अगर कोई legally challenge करेगा, तुमको एक human को रहना पड़ेगा. So for that, radiologists will be there, but there could be a job cut down. Okay. बहुत सारे जॉब अगर सोच लो कि एक को हॉस्पिटल में 3 को रेडियोलॉजिस्ट थे और AI आ जाता है जो कि सारा काम कर देता है. जस्ट यू हैव टू ओवरव्यू इट एंड मेक द डायग्नोसिस, अ क्लियर कट डायग्नोसिस. फॉर दैट 3 के जगह में एक रेडियोलॉजिस्ट से भी चल जा सकता है. ठीक है, तो ऐसे करके जॉब कट डाउन हो सकता है इन फ्यूचर. नाउ इन इंडिया सेटअप, हाउ मच इट इज पॉसिबल, still it is in doubt. So that one risk is there in radiology, I would like to highlight. In dermatology, what other things will force you to take dermatology or will incline you to take dermatology is that it's a very visual branch. Okay, क्योंकि देख के diagnosis करना पड़ता है. Yes, there are histopathology, there is dermoscopy, but our clinical eye is the best tool. And in resource poor setting, जब हम लोग अपने आप practice करेंगे तो उतना ऑप्शंस अवेलेबल ना भी हो सकता है. सो इन दैट केसेस डर्मेटोलॉजी इज अ वेरी मच विजुअल ब्रांच. ओके, एंड इफ योर विजुअल मेमोरी इज नॉट दैट मच पावरफुल, देन आई वोंट सजेस्ट यू टू टेक डर्मेटोलॉजी. और एक रीज़न मेरा था कि डर्मेटोलॉजी लेने का was that my visual memory is a bit good and visually I like to see things and can correlate. So ये वाला एक strong point था मेरा dermatology लेने का, because after I left MAMC, radiology seat was also vacant and वहाँ पे तो work life balance वहाँ पे radiology में था. यहाँ पे dermatology में 110 hours duty था, but in radiology 70 hours was the duty. And I had problem in the society also. So if I would have taken radiology, I could have shifted to a distant society also. But my priority was always my stream. Okay, so I took dermatology because my priority was the OPD basis clinics and the visual learning. And independent setup you can easily get in dermatology in any medicine streams. Most of the medicine streams where you can work in OPDs, you can get the independent setup. Another emerging branch is the nuclear medicine and radiotherapy. As I have highlighted in that video, you would be able to see that video after this video only in the end screen. So cancer patients are increasing day by day, so the demand of nuclear medicine is also increasing. It is just like radiology only, and it has therapeutic purpose also, both diagnostic and therapeutic. तो तुम्हारा जो भी पेट स्कैन होता है वहाँ पे एक को न्यूक्लियर मेडिसिन गाय लगता है जिसका साइन ज़रूरत है, तो तुम्हारा साइन शायद 3-4 को सेंटर में चलेगा, तो उन 3-4 सेंटर में से ही तुमको रेमुनरेशन मिलेगा. सो दैट इज़ हाई अर्निंग possibility in nuclear medicine as the saturation is less. Okay, in nuclear medicine there is very less saturation as there is very less number of seats, so it is a very good stream. And radiotherapy is also an emerging stream, and the best part is that you can do DM medical oncology after radiology. Okay, DM medical oncology, and that is a very high demand. Now oncology का patients इतना ज़्यादा है, even they can do the palliative care also. The radiotherapy guy, the medical oncology guys can do the palliative care also. So it is a very high earning stream, and chemotherapy drugs are so much costly, so it is really a very high in an earning stream and a booming stream, medical oncology. After that is the physical medicine and rehabilitation. It also gives a perfect work-life balance. Sports medicine, I think in VMMC only it is there, so sports medicine is also an option. Palliative medicine, another emerging branch. It gives a perfect work-life balance. Average salary is up to 18 LPA lakhs per annum. And all pre and paraclinical subjects also come in the domain of work-life balance, because they all provide the work-life balance. Duty hours are less and less hectic. Patient interaction is also not there, so it is not much hectic on night duties are not there. So in this pathology, biochemistry, the best part is that you can do DM hematology. तो पैथोलॉजी में एक नॉन क्लिनिकल स्ट्रीम जैसे कि बायोकेमिस्ट्री जो कि बहुत दूर जाता है, बट वहाँ से भी अगर करोगे ना तुम्हारा स्कोप है कि डीएम हेमाटोलॉजी कर सकते हो. किसी दिन किसी का एग्जाम खराब जा सकता है, एनीथिंग कैन हैपन, बट दैट डजंट डिटरमाइन योर फ्यूचर, राइट? सो यू कैन गो इनटू अ क्लिनिकल ब्रांच फ्रॉम अ प्री क्लिनिकल स्ट्रीम ऑल्सो. सो आई हैव हाईलाइटेड दीज स्ट्रीम्स. And in pharmacology you can go for DM clinical pharma also. Other preclinical streams are also good, pre and paraclinical streams. Microbiology is a good one, community medicine is a good one. You can become an epidemiologist, or you can get into the health services of your state, and you can get an administrative post also. So these are also good streams, but मैंने इनको highlight किया है जिनमें हम लोग clinical में switch कर सकते हैं. DM seats are there, okay. एंड ये सारा जो लो कट ऑफ जिन लोगों का जाता है या फिर अबव 20,000 रैंक, सो उन स्ट्रीम्स के बारे में हम लोगों को ना ज़्यादा आइडिया नहीं होता है. टॉप स्ट्रीम्स के बारे में तो हम लोग को सारे को आइडिया रहता है कि इसके बाद ये डीएम कर सकते हैं, ये कोर्सेज हैं, बट लोअर स्ट्रीम्स के लिए हम लोगों को आइडिया नहीं रहता है. सो इफ़ यू वांट आई वुड मेक अ वीडियो आफ्टर द रिजल्ट्स, ओके, दैट विच लो स्कोरिंग streams or the low cutoff streams are good and what prospect they have. Now coming to the third group, that is the surgical block, and we can divide into major and minor surgery. What is our affinity? Is it major surgery or is it minor surgery? In minor surgery another stream comes, that is the dermatology, because dermatology has both medicine and surgery, and with that it also has dermatopathology, so it has exposure of 3 subjects. But as it comes in work-life balance, I haven't clubbed it under this heading. In major surgery, top stream is the general surgery. Here you have scope of MCH, but this is a job of delayed settlement. So here comes a good surgical option, that is orthopedics, which has very high earning potential. At least in the Eastern India, here it has very much high earning potential, because without knee transplant and transplants also, seeing the fracture patients and so much joint pain is prevalent here, you can earn at least 3 to 5 LPM after doing PG, okay. I know one senior resident who earns 10 LPM. He has passed out 2 years ago. Just after 2 years he is earning 10 LPM, but that is in periphery, okay, not in the metropolitan cities. Orthopedics is for men. I shouldn't be gender biased, but here I have to be because it is mainly selected by the men, and obs and gynae is mainly selected by the women. Okay, so obs and gynae is a high earning potential, and mainly the gynae is emerging and the reproductive medicine is emerging. Okay, and the gynae oncology is also emerging. These are the emerging streams of obs and gynae. In minor, eye is there, but the problem is that it is very much saturated. Okay, and independent setups are less because multi-speciality eye clinics are being set up and multi-speciality eye hospitals are being set up. So अब क्या हो गया है ना, अब ऐसे डॉक्टर के पास नहीं दिखाना चाहते, ठीक है, एक ही जगह में रिफ्रैक्शन हो जाएगा, एक ही जगह में ग्लोकोमा का चेकअप हो जाएगा, वैसे मल्टी स्पेशलिटी हॉस्पिटल्स में जाना चाहते हैं, वैसे मल्टी स्पेशलिटी क्लिनिक्स में जाना चाहते हैं आई में. ओके, सो यहाँ पे एक थोड़ा सा प्रॉब्लम है. इट इज़ मोर ऑफ कॉर्पोरेट. इंडिपेंडेंट सेटअप चांसेस आर लेस. ENT is a good stream, and if you are good with your hands, you can do rhinoplasty and all surgeries, head and neck surgeries, which are in great demand, and OPD basis is also there. In obs, gynae and ENT, the OPD patients are really great. I also has OPD patients. General surgery as such, just OPD can't fill your stomach. Okay, it's not your bread and butter. The surgery is your bread and butter. Psychiatry, I have kept it as a different stream because इसके लिए ना कुछ मतलब रैंक ऐसा आ गया कि साइकियाट्री मिल रहा है, ले लेते हैं, तो ऐसे करके ना साइकियाट्री में साइन करना उतना ईजी नहीं है. सो फॉर साइकियाट्री यू शुड हैव द पर्सनल एफिनिटी फॉर साइकियाट्री and literature loving, because here also I see faculties tell their PGTs to learn good books. Okay, तो यहाँ पे ना ज़्यादा लिटरेचर ओरिएंटेड होते हैं, ज़्यादा क्लिनिकल से मेरे को लगता है कि लिटरेचर ओरिएंटेड ज़्यादा होते हैं. एंड इट नीड्स अ स्ट्रॉन्ग कम्युनिकेशन स्किल्स एंड ऑल्सो अ लिसनिंग ईयर सो दैट यू कैन लिसन टू कंप्लेंट्स. बहुत लोग बहुत कुछ बोलते हैं एंड उनका मेंटल स्टेट या फिर एम्पैथी दिखाने के टाइम में उन लोगों का भी डिप्रेशन हो जा सकता है. बिकॉज आई हैव सीन अ रिसेंट स्टडीज दैट साइकियाट्री पीपल आर ओनली more prone to suffer from depression and are more undergoing divorces. Okay, so patient से थोड़ा सा ये सब induction होता है. So you should be prepared for all this, and then only you should take psychiatry. You should have an affinity for the subject. So I have kept it as a different stream, not under medicine. So I hope the video was helpful. Another a bit is left, but before that, if you haven't subscribed my channel, तो जाके सब्सक्राइब कर दो, क्योंकि तुम सब्सक्राइब बटन में क्लिक करोगे तो वो वाला ऑप्शन हर टाइम करेक्ट होगा. ठीक है, इसमें कोई नेगेटिव मार्किंग नहीं है. आफ्टर दैट, एंड नोट्स विच आई वांट टू गिव. सिलेक्ट योर प्रायोरिटी. ठीक है, ये को चार गो जो मैंने सेक्शंस बोला ना, ये चार में से एक गो को अपना प्रायोरिटी चूज करो. हो सकता है कि your priority is after general medicine, my priority is general surgery, हो सकता है, but at first you choose your priority and you keep the streams in mind before the result arrives. You should keep in mind which all streams you are going to take. Okay, क्योंकि ऐसा बहुत टाइम होता है कि I am showing you the stats. Okay, 1078 residents left their course in 5 years. This is just a newspaper stats. 1075 residents left in just 5 years, in these recent 5 years. So the leaving rate is very much high because we are not sensitized to the stream, how we should choose the stream and which college to choose. So इसीलिए ये हो जाता है कि हम लोग लीव करते रहे residents, and you shouldn't compromise with toxicity or a subject which you are not inclined to. सो इसीलिए ये वाला वीडियो बहुत ही इंपॉर्टेंट हो जाता है. तुम अपना प्रायोरिटी ठीक करो. ठीक है, आफ्टर दैट आई वुड सजेस्ट यू दैट यू शुड हैव द एफिनिटी फॉर द सब्जेक्ट, बिकॉज यू हैव टू अर्न विद दिस सब्जेक्ट विद द रेस्ट ऑफ योर लाइफ. सो यू शुड हैव द एफिनिटी टुवर्ड्स द सब्जेक्ट. लिसन टू योर हार्ट. मेरा बात मत सुनो. मैंने इतना देर तक बकबक किया, इतना ज्ञान दिया, बट मेरा बात मत सुनो. ठीक है, इफ़ योर हार्ट इज टेलिंग समथिंग आउट ऑफ द बॉक्स व्हाट आई हैव सेड, देन गो फॉर दैट. लिसन टू योर हार्ट. because this is your life, this is your decision. You have to take the decision, and your life, your decision. End point में मैं बोलूँगा that branch is more important than the institute. Okay, कोई भी इंस्टीट्यूट से पढ़ो, टॉप डॉक्टर्स अगर देखोगे ना, मतलब एम्स दिल्ली से ही सारा टॉप डॉक्टर्स निकलते हैं, ऐसा बात नहीं है. बहुत सारे स्टेट कॉलेजेस से, इवन डिप्लोमा कोर्सेज से भी टॉप डॉक्टर्स निकलते हैं. आई एम गिविंग यू एग्जाम्पल जस्ट आफ्टर दिस. DNB of the stream particular, like DNB ortho you are not getting MS ortho, then go for DNB. Okay, DNB radiology you are not getting MD radiology, go for DNB. ठीक है. Here in India, patient doesn't understand the degree actually. Most of the cases, if you are practicing in the metropoles, then most of the patients will understand. But in many cases, the patient don't understand. I see prescriptions of mainly about 20% of the patient come from quack doctors. जिन लोगों का डिग्री ना A से Z से कोई भी लेटर से अरेंज कर दो, उन लोगों का डिग्री बन जाता है. Like I saw a degree of quack doctor whose degree was UPSC. भाई ये तो एग्ज़ाम होता है. UPSC कौन सा डिग्री होता है मेरे को तो नहीं पता. अगर तुम लोगों को पता हो तो बोल देना. कोई लिख देता है APMT, कुछ भी डिग्री लिख देता है. ठीक है, तो तुम DNB हो कि डिप्लोमा हो, वो मतलब उतना कुछ मैटर नहीं करता. तुम्हारा स्किल्स, कम्युनिकेशन स्किल्स, दीज आर द थिंग्स दैट मैटर. एंड आई एम गिविंग यू एग्जाम्पल फ्रॉम माई फील्ड. द डॉक्टर हु इज IADVL president of my West Bengal branch, and he has really good hold all over the India, and he is an internationally famous doctor. He is also diploma in dermatology. Okay, he is not MD, he is diploma. So don't think that you are getting diploma you shouldn't take because it is a course below the MD. So ये मत सोचना. ठीक है, पोटेंशियल बंदे में होता है, ब्रांच में नहीं. जैसे कि मैंने हाईलाइट करके बोला है, स्कोप ब्रांच में नहीं बंदे में होता है. ठीक है, तो कोई भी ब्रांच चूज कर लो जैसा रैंक में आ रहा है, या फिर तुम और एक बार देना चाहते हो वो देख सकते हो. बट आई होप दिस वीडियो वुड हेल्प यू टू सिलेक्ट द ब्रांच, and be it MD, be it DNB, be it diploma, be it in any college, that doesn't matter at all. Okay, the potential you have is the matter, that how you are going to shine. And previously I had told that this exam will decide your future. So मैंने तब बोला था ताकि मैं तुम लोगों को मोटिवेट कर सकूं. ठीक है, दिस एग्जाम डजंट डिटरमाइन योर फ्यूचर. तुम कोई भी कॉलेज से करो, तुम शाइन कर सकते हो. अगर तुम्हारे अंदर वो इच्छा है ना, यू कैन रियली शाइन. In the end, I would like to say that for counseling, you can follow my Telegram channel and the WhatsApp channel also. The links are given in the description below. Any important announcement regarding result or counseling, I would highlight in the group. Okay, I would send PDF according what our colleges are good and all. Now you can see another video that is highest earning medicinal streams. So go watch this video now. So bye, stay safe, and we want justice.